Thank you, Prof, for your time. Because this is a different disease we are dealing with from what we are used to in terms of the vaccine. Once I've been vaccinated, should I still wear a mask to prevent others from being infected? Or does life go back to normal, being mask-free?
Yeah. $1 million question. So the answer to your question is that you should continue wearing masks. You should continue practicing social distancing, avoiding congregated settings, and you should be religious and consistent with health protocols. And I'm saying this because I know that there are so many unknowns about COVID-19, and there are so many unknowns about COVID-19 vaccine. So if you look at COVID-19, for example, we just don't know how long immunity will last. So the same thing applies to the vaccine. It's too early to tell how long immunity will last, immunity that is elicited by the vaccine. So because of this reason, if you are vaccinated, it doesn't mean that you should think that you are 100% immune to infection, because we just don't know how long immunity will last. And we also know that for the people who participated in clinical trials, you will remember that when we talk about clinical trials, we often use the term efficacy, right? So efficacy is a measure of symptomatic laboratory confirmed infections. And if the vaccine has got high efficacy, it means that you have got few infections in the vaccine group compared to the placebo group. And then if the efficacy is low, it means that you actually have higher number of infections in the vaccine group as well. But without complicating your question, all I'm saying is that it has been observed and reported in participants who participated in clinical trials that you can actually get infected despite being vaccinated. Remember that for the rollout programs, this is too early. Now it's just too early to tell whether people can be infected despite receiving the vaccine in the public, because the rollout programs only started, the early adopter, which is UK, only started late December, and most countries started this month. So we don't have the data, but we do have data from clinical trials which show that even those who received the vaccine can experience infections. But here is the difference. If you are vaccinated, even if you get infection, the infection is usually subclinical, or what we call asymptomatic. And very seldom these infections will progress to severe disease or will lead to death. So that is the major difference between being vaccinated and somebody who has not been vaccinated. So these are part of unknowns when it comes to COVID-19 infection and also the vaccination program. So the answer to your question is that we should continue masking and distancing, because it doesn't mean that if you are vaccinated, you may not get infected. But the difference is that if you get infected, you don't necessarily suffer from severe disease or die from infection. So there are two questions to this. If you are infected after vaccination, what does it mean? Does it mean that you can transmit the virus to other people? And once again, we don't have the answer, because the clinical trials were not designed to answer that question. However, we know from natural infection that those who had asymptomatic infections, right, even in family setting, they can actually transmit the virus to other people in the same, household. So potentially, if you are vaccinated and you get infected, you may infect others. But as I say, we just don't have the data on this because clinical trials were not designed to answer that question. So we will have to investigate this with the rollout of vaccination programs.